don't want a piecemeal of restrictions from county to county and place to place. And also, as we've said many times, we're dealing with a virus that knows no boundaries here. So from a public health perspective, how effective really is it to have one county on the Eastern Shore as well as Richmond staying closed when the surrounding areas are not? And what do you say to people who say that a regional approach should have been embraced sooner?
Yeah, the question is about the regional approach, why some localities have been allowed to delay entering phase one, and I think you've already heard Northern Virginia, the Eastern Shore, Accomack County, which has a unique situation with the chicken processing plants, as well as a couple of nursing homes, and then here in Richmond. Jackie, I would answer your question just to step back a bit. I have said all along that this is a fluid situation. It changes literally by the hour, and I'll just offer you a comment as a doctor. Things change. A diagnosis might be made one day. The patient may come in a day or a week later. Things have changed, and we have to reassess. We have to reevaluate, and we change our diagnosis, and we change our plans. That's the way we move forward. So as we have looked at the data, as we have entered phase one, there are obviously several areas, several regions in Virginia that numbers are not as promising as other parts of the state. And so at their request, as you heard on Wednesday, we had the leadership from Northern Virginia. They submitted a letter asking for permission to delay entering phase one. We had the same from the mayor, Mayor Stoney, from Richmond yesterday, and also from the Board of Supervisors on the Eastern Shore. So I listened. They're local leaders. They know that area better than certainly anybody else, and I granted their request.